Hello everyone, I'm Dr. Virangi Doshi and I shall be presenting our unique do-it-yourself model of ROP Sankara Skill Transfer System. Don't we all remember how scary the idea of screening those tiny souls felt at first? Well, it's an even trickier situation when we have to examine and document good quality photographs with wide angle fundus cameras, which require a good hand eye leg coordination, which, if not competent with, can lead to undue stress on the child. We know that documenting and screening involves wide angle fundus cameras, which have a probe resting on the eye in one hand, a foot pedal being operated by one leg to capture good images in a jiffy, all the while our eyes and mind dynamically taking note of everything. To ace this sync needs practice, and for this we need simulators. That's when we put our Jugadu minds at work and designed our ROP Shankara Skill Transfer System using a commercially available newborn baby mannequin and the commercially available Reti, thus saving us a large cost. To make our model, we used a newborn baby mannequin available online and cut the rims of the eye for a better exposure. We then secured the Reti from underneath with the help of a hot glue. Printouts of various ROP pathologies can be used as templates and can be molded and secured in the detachable posterior portion of the Reti, as shown in the video. Alternatively, we made use of a mobile screen for a very high definition image, as shown here. To study the effectiveness of this model, we carried out an in-house small experiment with optometrists who were not trained in ROP photography. And we noticed that there was an improved handling time of the machine and decreased screening times. And at the same time, the quality of images captured over time improved. In contrast to other available simulators, which burn a hole in the pocket, can be used either for direct or indirect ophthalmoscopy and can be used only for particular pathologies like diabetic retinopathy. Our model is both cost effective, can be used for both direct and indirect ophthalmoscopy training, and can be used for multiple pathologies. To the best of our knowledge, there is no such model for ROP photography screening training. Considering the design related aspects, the imaging in our model is not wide field, but that is one aspect which is under consideration. Thank you for your patient listening.
Very good, very good. Any questions?
So that's a very nice model you've created. I just wanted to ask you that when you are placing the camera on that eye, I assume that the eye is having a plastic there.
Correct, yeah.
So do you put any kind of agent in between?
We put a viscoelastic over the eye in between the probe and the plastic model.
And the images are captured quite clear?
The images are quite clear. If you would allow me to open it once again.
थोड़ा स्क्रीन ऑन कर दीजिए, इनका प्रेजेंटेशन ऑन कर दीजिए.
So the images are equivalent to the template which we use. So the template printout, if it has some pixelations, the images are such. But like I said, we also use the mobile screen for a better quality image. So in the same way, the images which we see on the laptop are also equally good. I'll just show you.
Yes. I wish you could have shown us the pictures first before undergoing this training through the simulator,
Right.
and then after that. So,
Right.
And grading those images on issues like clarity and details.
Yeah. Sir, that's what the self-assessment questionnaire, we had a couple of parameters for the optometrists who are undergoing the training. So we had 4 parameters like sharpness of the image, the graph of which I've placed in the presentation. One was sharpness, one was the artifacts, one was the pixelations, and one was the percentage of image they could capture in the photograph. So on the basis of that, we had standardized templates, and they had graded themselves. Just for an example, I've just placed the sharpness of the images here, but otherwise they had improved overall.
That is what we were saying. That
Right.
if you could have demonstrated that there was a significant, it is expected.
Yes, yes.
It is
So
expected.
I
for
understand,
paucity of
sir.
time, we'll have to move forward.
Sure.
Kind of
Thank you.
pre and post test.
I'd like to
you
request
can do.
Sanjay sir to please
How
give
many optometrists have you
certificate to
trained
Dr.
till now?
Virangi
We had
Doshi.
trained approximately 8 to 10 optometrists, 2 of which had to be transferred during the training, but they underwent approximately 8 to 10 sessions of training.